A new report from OpenTheBooks, a watchdog organization focused on government spending, shows the largest 20 nonprofit hospitals in the U.S. received $23 billion in taxpayer-funded financial aid during the COVID-19 pandemic. These hospitals generated massive profits, and their cumulative net assets soared from about $200 billion in 2018 to $324 billion by 2021, a 62% increase in just 3 years. Of these 20 hospitals, reportedly only 2 of them partially paid back the bailout money. While Americans were locked inside and forced out of work due to this public health emergency, they said, the Mayo Clinic, for example, watched its net assets rise by 92% between 2018 and 2021. The Cleveland Clinic Health System also saw a 60% spike in its net assets, and the Indiana University Health System witnessed a 47% spike. But the hospitals aren't alone. Healthcare executives massively profited from COVID-19 too, and some are pocketing compensation packages that often exceeded $10 million per year. For example, the CEO of Ascension Healthcare made $13 million in 2021 alone, and made a total of $22 million between 2018 and 2021. Joining us now to discuss is Adam Andrzejewski, the founder and CEO of OpenTheBooks. Adam, thanks for being here tonight.
Well, Kara, thanks for having me on. Thanks for having me back.
Great. So based on your organization's new report, would you say these nonprofit hospitals were working for the public good or for their own bottom lines during this pandemic?
Well, it certainly looks like they were working for their own special interest and not for the public's interest, Kara. I mean, take Ascension Health. You correctly delineated that the chief there, we found, made $13 million in 2021. And over the course of the past 3 years, made a total of $22 million on his pay package. The assets of Ascension Health went up by $6 billion during the pandemic, and they took and kept $2.7 billion worth of taxpayer-funded COVID aid. Now, we're calling on Ascension Health, since they pocketed every dime of COVID aid, it actually flowed to their bottom line, their net assets, on a profit basis. We're calling on Ascension Health to pay it back. Kaiser Permanente, they're the largest nonprofit healthcare system in the country. Their net assets went up by $20 billion during the pandemic. They actually paid back $500 million worth of congressional COVID aid. There were 18 of these nonprofits, and we're calling on them to pay back their taxpayer-funded COVID aid. At the end of the day, they didn't need it.
Yeah, I mean, it's really the least they could do at this point as well. And as you guys rightfully point out, is that after all this money was really handed over to them, it was a great wealth transfer, you could say, from the middle class to corporate heads, both in big pharma and elsewhere. But when it comes down to it, some of the numbers we saw, the life expectancy has still dropped by 2 years, 2.5 years, depending on what are the numbers you're looking at. So help me make sense of that, because where was this money going if it doesn't seem like it was improving life expectancy, even when we had so many treatments for COVID that, of course, were punted because a lot of them were ones that hospitals, big pharma couldn't make money off of. So what's going on there?
So 100 million Americans have medical debt, Kara, and the average cost of health insurance is $22,000 for a family of 4 in this country. So it's very expensive. Costs are soaring for the people. And these 20 nonprofits who racked up big profits during the pandemic, there's a nonprofit called Patients' Rights Advocate. They took a look at whether these hospitals were complying with federal law on healthcare price disclosure. This was instituted during the Trump years and finalized to their credit by the Biden administration in 2021. So it's been 2 years. And guess what? Out of the 20 hospitals who racked up the big profits during the pandemic, only one of them was 100% compliant with the audit from PRA. 9 out of 20 of those hospitals actually were 90% non-compliant. They were less than 10% compliant with the federal healthcare transparency rules. So you have CMS at the Biden administration. They're supposed to be enforcing this rule. They are not. And, it's like playing baseball with one side, the patient blindfolded, the other side, the nonprofit hospitals, running up the score at will. And running up the score they certainly are in terms of their own pocketed profits.
It really is terrible. And of course, just for me living my life with some of the health issues I have, again, I've gotten a very up close and personal look at the insurance aspect, the money aspect to all this. And let's just say I've been left very, very upset. So, I can see why there was so much frustration and so much anger with just, everything going on with this. And last question for you before I have to let you go into the break. As you guys note as well, these public health securities are operating under IRS Section 501c3 of the tax code. Does that affect anything here, as you're saying, for them to, say, pay back?
Every dime of that was borrowed against the future of this country and added to the national debt. So look, I think the House needs to hold hearings, take these CEOs from the nonprofits, make them justify their pandemic profiteering in front of the American people.
That they do need. I will get my popcorn. I'll be right there, first seat, the first row. Adam, thanks for joining us tonight and breaking down the numbers.
Thank you, Kara.